My name is Dr. Tiffany Haynes, and I'm one of the co-directors for the Health Promotion and Prevention Research Program here at UAMS. So you may be wondering what health promotion and prevention research really is. And whenever I explain it, I like to ask people to imagine everyone around them, their neighbors, their friends, their family, their coworkers, their classmates, and think about how many of those people are dealing with a chronic disease right now: hypertension, heart disease, diabetes, cancer, even depression. And we probably can think of at least one, if not more, of our friends, family, and community members who are dealing with a chronic disease. Now, what would it mean if we were able to improve their quality of life? What if we were able to make sure that they had more years to live here and that the years that they're living here, they're living the healthiest way that they can? That's what health promotion and prevention research allows us to do. It allows us to look at the science, what we know works, and take those tools, strategies, programs, and interventions and put them in the hands of the people who need them the most, our community. And when I think about my own work and how it connects to health promotion and prevention research, I think about the work I'm doing right now in churches. So right now we have a project that looks at a depressive symptom intervention for rural African Americans that we are providing through churches. Why? Because we know that a lot of people are dealing with depressive symptoms, but they're not getting the help that they need. Maybe it's because of access, no insurance, or they don't know where to go. Or maybe it's stigma because they're feeling a little bit embarrassed about saying, I go to a psychologist, psychiatrist. And so we're looking at ways to take the science, what we know works, and putting it into the community so that people can live a more emotionally healthy life. And I really think that this is a great example of what it means to take science and make tools that are going to be relevant and accessible to people who need them the most. When our students leave our program, I really like for them to think of themselves as a bridge. So if we think about that there's a gap right now between what we know in science and what actually happens in the real world and in practice, and I want our students to be the bridge between the science and practice. I want them to close that gap. So I think that when our students come into the program, they have a passion for helping others. And when they leave the program, they have the research skills necessary to go into the science, understand the evidence, take that evidence and tailor make packages of programs and strategies that can really help individuals live the healthiest life that they can. And one example of this is one of our recent graduates was working on a project was looking at gun violence in young African American men. And we know that's a significant public health issue here in our nation. And she was able to go into communities, talk to young African American men, talk to them about what was it like to be exposed to gun violence, how did that impact your mental health, and what should we do to help other people who may also experience gun violence. She could take that science and tailor it so that people, young African American men who may not go to the clinics, who may not want to talk to a psychologist, but can get the help that they need so that they're not having the mental health issues that go along with being exposed to gun violence. And now she's doing a project to see how can we take that and put it in the hospital settings so that we are getting people who may just get exposed to gun violence the immediate help that they need to help with their mental health. And so that's an example of being a bridge. That is how we take the science and we put it to work in the community so that we can improve health. I hope that, from listening to this, that you're excited about being a bridge, that you want to be, you see yourself as bridging that gap between the science and the community. And if so, we welcome you to our program. We are going to be excited to talk to you more about it. But I want you to start by going to our website, which is publichealth.uams.edu. And then you go to the academics page and you can look for the Health Promotion and Prevention Research Program. On that page, we're going to give you all the information you need to know about how to apply. Remember that all application materials are due on January 15th. So you don't want to delay. You want to get started today on getting your application together. The next thing I want you to think about is going and looking at our faculty profiles. So I talked about my work and what I do with mental health, but we have faculty who are doing things with LGBTQ populations, with incarcerated populations, with tobacco cessation, with working with faith communities, working with cardiovascular health, working with substance abuse. So if there's something that you want to work on, we probably have a faculty member who's working on it. But we want you to get familiar with our faculty. So go to the profile page, see what we're working on, see what our expertise that we bring to the table. And then, figure out some time that you can kind of connect with us via email, maybe setting up a Zoom meeting so you can talk more about how They can help you on your journey to becoming that bridge between science and community health. Again, I think that one of the most important things that we can do right now is to really help build the health of our communities. Because we know that we have healthy individuals, we have healthy families, and if we have healthy families, we do have healthy communities. And if you want to be a part of that, then please reach out to us and think about applying to our doctoral program. We look forward to hearing from you soon.